And I caught up with the New South Wales Health Minister, Brad Hazzard, late this afternoon.
There's been a lot of tough decisions, Chris, since this started, which is on Christmas Day, it'll be exactly 11 months since New South Wales had its first 4 cases of COVID. But I'd say this particular one, having in mind the particular meaning of Christmas to all of us, yes, it was pretty tough, and it took a lot of effort for the senior ministers and the senior public servants to actually arrive at this point.
The overriding theme here, though, was, from what we heard from the Premier, to improve the Christmas lot for most people, to give them an opportunity to celebrate a form of Christmas, if not the kind of Christmas they would normally experience.
That's exactly right. We wanted people to be able to have some Christmas, and we were concerned, particularly after the last few days. It's only been, I think, just on a week, but it has certainly been quite a week. And I think it's up over 97 cases or so now associated with this Avalon cluster. So it certainly has us on high alert. On the other hand, we are relatively pleased that the bulk of these cases are directly related to the cluster. And clusters, it sounds bad, but it's actually, from a health epidemiological point of view, it's good when you know where they're all connected.
Explain the reasoning behind cutting the northern beaches into 2 parts and dealing with the north differently to the way you deal with the south.
Well, Dr Chant, the public health officer here in New South Wales, and her team looked at the figures for where we're seeing most of the cases, and most of the cases, as you'd expect, are at the northern end of what the locals call either the northern beaches or the peninsula. And that's because most of the cases actually started at the Avalon RSL or the Avalon Bolo. I mean, obviously not the primary case, because we still don't know where that came from, but most of the other cases are directly or indirectly related to those 2 particular occasions on the 11th and 13th of this month. So looking at that, it just seemed, when we looked at the numbers that were on the southern side of the Narrabeen Bridge, which is near, for those who know, Pittwater Road, Waterloo Street, down at Narrabeen, there were far fewer. And so it seemed that it wasn't really fair just to do it on the basis of a whole local government area. It's a convenient map, but not reflective of the reality. So that's why there's now that difference. A lot less risk, still risk, but a lot less risk on the southern end. So basically from about Narrabeen Way down to Manly.
Are you getting closer to finding, as you describe it, the primary source, this missing link?
I was talking to Dr Chant on at least, I spoke to her only a few minutes ago actually, and even as at this evening, still no clarity on that. Look, it is one of the dilemmas when you're in a worldwide pandemic. You'd like to have the initial case. We certainly thought we were close to that. She had said, and I had said off the back of what the public health team were thinking, that a particular woman who got off a flight on the 1st of December, who had a very similar genomic sequence to the cases at Avalon, was probably the source, but now the thinking is perhaps not, because there's been further work on the genomic sequencing and we don't think so. So at this stage, the short answer is no, we don't know yet.
You're upset with some businesses and some hospitality venues, aren't you, who may have the QR codes in place, but they're not enforcing the whole policing of people using the QR code. Explain that to us.
When a case is a positive case, the tracers, and they are gold standard, these people who work through the night in New South Wales Health, making phone calls, tracking, tracing, asking often very complex histories of individuals as to where they have been in the previous few days, what they're telling us is that quite often, too frequently, when they ask the business, one of the businesses where the person might have been, for example, who's been in that particular facility in the recent day or days, they just aren't getting the answers quickly. And part of the absolute essential aspect of cutting off transmission of this virus is being able to find out who was near the person, the latest positive case, very quickly. Some of those businesses either don't have the data at all, or alternatively, which means they've forgotten to ask the person when they come, or the visitors, to actually use the QR code, or alternatively, they haven't spoken to their individual provider of the QR code and they don't know how to contact the company that is the basis or providing the platform for their QR code. So there's a few issues, which is why we're saying now We can't do this to our tracers, our health tracers. They need to be able to get this data fast. So we're now looking to move towards using the Service New South Wales equivalent of the QR code. And the health workers are saying we can get that quickly, and it helps immeasurably to track and trace.
And that will begin on January the 1st, and there'll be a hard and fast rule about the fact that people have to use it from January 1.
Yes, that's right, Chris. But what I would say to particularly the cafes and restaurants where they're operational, they're not operational at all on the northern beaches of Sydney, but elsewhere, when somebody comes into your coffee shop and they're about to order a coffee or a sandwich or whatever it is, don't do the order until you've actually got the QR code. That's your obligation to the rest of the community at the moment. And it's what's keeping your business open. If we don't get that information, if the health people don't get that information, we have a major problem for all of us.
In such a short space of time, we've had 2 consecutive days of single-figure overnight infections. That is incredibly impressive, isn't it?
It is extremely impressive, and again, it goes to the way New South Wales has approached this right from the word go. We have the best of the best health teams they're well versed, they know what to do, but of course they need the data. I think it is, look, there are 2 states who've been tested in this. The others tended to close their borders fairly quickly, and that meant, I think, in some cases they haven't learnt the full range of issues, because basically life is about experience, and COVID life, it is definitely about what you've suffered, what you've experienced, and what you learn from it. Victoria, I think, has learnt a lot now, and New South Wales has certainly learnt a lot. And what we know is that the QR codes are absolutely essential. We need to have people taken with us so they feel confident in coming forward to tell us they might have some symptoms. There's a whole lot of factors here, but we also need all the businesses to be with us on the journey.
Brad Hazzard, thank you very much for your time.
Thanks very much, Chris.